There's three parts of the heart. We have the electrical part of the heart, we have the plumbing part of the heart, and we have the pumping part of the heart. The stress test is actually looking at the plumbing. It's looking to make sure that those arteries that supply the heart with oxygen and blood supply are not occluded, and so therefore maybe you need a stent or bypass surgery. So in order to open that back up so that the heart's not getting, and that is getting enough oxygen and blood supply. They're seen in the ER and they come in with chest pain and it's ruled out that they're not having heart issues at the moment. Or they go into the physician's office for a annual physical and they say, you know, I've been having chest pain over the last so many weeks or whatever. Then the doc may say, well, whether it's chest pain or shortness of breath or fatigue, or maybe they've got coronary disease that they just like to check up and continue to follow. But at that point in time, the doc may say, okay, let's just do a stress test just to make sure that it's not actually your heart. Because chest pain can be caused by a lot of different things, but you definitely don't want to blow off the heart and it be the heart. So the first type of stress test that we're most commonly seen is just a regular treadmill. We increase the rate and the speed, or the incline and the speed, every 3 minutes and to a certain target, and they're looking for the heart not getting enough oxygen blood supply, looking for like what we call ST depression. So chemical stress, if they're not able to walk on a treadmill, or maybe they have a rhythm that doesn't allow them to walk on a treadmill, we can use a medicine called regadenoson. We work it with nuclear medicine. So again, they do those pictures, those resting pictures. Then they come in and we give them the regadenoson, which simulates the treadmill without actually walking on the treadmill. And then they do another set of pictures. Then we compare those two sets of pictures to see if they've got adequate blood supply at rest as well as with work. The Holter monitors look at the electrical part of the heart. We put that on and it monitors the heart for 24, 48, 72 hours, sometimes a month, and it'll give us every single heartbeat and look at if there's any abnormalities in the electricity. We have this little patch that this monitor fits into. I can program this to be an event monitor or a Holter monitor. We can, if it's like syncope where they've passed out, they might want to wear the 30-day monitor because it doesn't happen every day. Palpitations that happen every single day, you're going to want to wear more of the Holter monitor that you're only taking 24 or 48 hours.
The bread and butter of an echo is to use ultrasound to look at the overall structure and function of the heart, make sure that the heart is squeezing well, that the 4 valves inside the heart are opening and closing the way they should, and that none of the chambers are dilated or enlarged. The average echo takes about 45 minutes. There's no prep for the test, so patients can eat and drink and take all their normal medications. After the test, the images are sent to the cardiologist who interprets them and gets the report to your ordering physician. Common indications for an echocardiogram would include heart murmur, lower extremity edema, chest pain, shortness of breath, history of cardiac issues, dizziness, syncope. Those are just some common indications for an echo. All of our echocardiograms are interpreted by physicians at cardiovascular medicine in Moline or Davenport.
Cardiac rehab is a program for patients that have had some kind of cardiac event, some type of cardiac disease. It's a program that we've had for almost 25 years at Hammond-Henry Hospital, which is pretty exciting. But when they come in, we take a complete history. We go over their medications with them. They come in usually 3 times a week, Monday, Wednesdays, and Fridays is when we have our program, and we get to know them really well. They come for up to 36 sessions. What is nice about Hammond-Henry's cardiac rehab is it's a small group of staff that takes care of them. So when they come in, we know, they look a little pale today. They look like they didn't sleep well. I think that really is an advantage in a small hospital that we get to know them so well. When they're here, they wear a cardiac monitor. That allows us to see what their EKG rhythm looks like with exercise, and at rest lets us keep track of their heart rate in real time. And we also do multiple blood pressures each day when they're here. So we have registered nurses and we have respiratory therapists that work in our cardiac rehab Some of them go back since we started 25 years ago. Patients are so much fun. It's kind of like a coffee hour without the coffee in cardiac rehab a lot of times. We're talking about the weather, we're talking about whatever is going on in the world while they're exercising, getting stronger, and we're watching how their heart is tolerating it. So it makes it a really fun group to see them feel better over the up to 3 months that they're here with us.